Welcome to my top performance blog. I am here with Cynthia Mayshock, the Community Relations Manager at ICCE. Hi, Cynthia.
Hi, Scott.
How are you?
Good, thanks.
Hey, we just finished the intensive trainings in March
Yes.
for the ICCE. You and I did the FIT Supervision Intensive.
Yeah, it was really fantastic.
People were there from all around the world, Sweden, Norway, Portugal, a whole bunch of places.
Australia, Canada, yeah.
It's amazing. The whole idea of feedback-informed practice continues to spread. And as I mentioned on a previous blog, part of being successful when implementing it is using technology. And today we have the Vice President for MyOutcomes, Cindy Hansen. Hi, Cindy.
Hi, Scott. How are you doing there?
I'm very good. I'm glad to have you here and be able to talk with you about MyOutcomes.
Yes, and I'm glad to have an opportunity to share a little bit more with your readership about what it is that we do here.
Great. And I know, because I was involved very early on with the very first iteration of MyOutcomes, that things have really changed. So what's evolved over the years about MyOutcomes?
We want someone to be able to log in for the first time, and if they know already how to administer the ORS and SRS, to be able to successfully navigate the system on their own.
Okay. And, you know, in a previous blog, I would say maybe a couple of months back, I reported some research by Dean Fixon about implementing different evidence-based practices. And of course, feedback-informed work is an evidence-based practice. Part of implementation is getting the technology right that support clinicians. And so what would you say is the biggest challenge you face when it comes to implementation of the system?
Well, it's convincing people, that they need training to, as I said, not necessarily use the system, but learn how to use the measures effectively with their clients. And then also for the larger agencies, implementation. And as you mentioned, the work of Dean Fixon has been quite critical in our developments. So here we are. We are on the provider home screen. So when you log in, this is where you come. And you can see, you know, at a glance, we've got the familiar color coding, red, yellow, and green, indicating, you know, how the client is doing. And if you were to click on that, it would take you to a graph, an interactive graph. You can see all the little scores. You can look at subscale scores, lots of rich use of data. And then also conveniently located next to it, the blue dots, you just click on that to administer whatever measure is next for the individual.
Okay.
And that's when the client is sitting there with you. If the client is, you know, you're doing telephone counseling, or maybe you have multiple people and you want to administer the measures to everybody at once, we also have this new feature called Give Access. And what Give Access does is it actually gives the client their own login, so they can log in to the system.
Wow.
And well, they're going to enter their scores, and they're going to see their results. And we actually have so for several years, a client could access the system, you know, from a computer or a tablet. MyOutcomes is fully functional on a tablet, but a phone was a problem. Phones are pretty small, and so in January of this year, we've actually released an app called MyOutcomes Mobile. And MyOutcomes Mobile is an app. It's for the client. It's for the client to log in on their phone or on their tablet and enter their scores. And it's free. It's free to download from Google Play or iTunes.
Okay, so you could have 100 clients and all of them could download that app and use it at no cost to the clients.
No cost to the client, or we don't charge a connection fee or anything like that.
Wow, that's very amazing, really. We're talking now about at ICCE, given what the research literature says, that feedback helps, but it's not enough. Feedback will help us get back on track. But for therapists to really learn and get better, they have to have a plan of action. And having a system like this that allows you to compare what you did last year against what you're doing this year, you could see whether that particular plan was having results.
Exactly.
Perfect.
Exactly.
Are there different kinds of services? Do you always get the full version of MyOutcomes, or are there different versions?
Yeah, well, what we've done is we've broken MyOutcomes down into MyOutcomes Pro and MyOutcomes Essentials, and these used to be just different ways of are you an agency or are you an individual? But
Okay.
MyOutcomes Essential, to make it more cost effective, what we've done is we've now you can just get a provider level account. So it comes with all the features a provider needs.
Mm-hmm.
It doesn't have those administrative supervisory tools attached to it, and so we can offer it for $19.95 a month.
Wow.
Yes.
Okay, so if you're not working for an agency and you don't need to categorize your data by the administrator, by different programs, by supervisor, then you can have access to all the same bells and whistles for under $20.
Exactly.
And Cindy, tell us, I can see here the number here. Is that the best way to get hold of you?
That's our toll-free number. That's right, and that's why I like it. It's toll-free, and I've also put my email address on the screen here, and people are welcome to contact me. One thing that I didn't mention earlier when we were talking about resources for agencies is I also do offer 30-minute implementation consultations for free.
Okay.
For agencies.
So if people want to figure out and kind of get started how to use the measures and use MyOutcomes, they can set up an appointment with you.
Absolutely. Yeah.
Perfect.
It's the highlight of my day.
Well, knowing you, Cindy, I know that's true, actually, that you really do want to help people be successful. There is a learning curve, obviously. You've worked very hard to make that simple. The price is very competitive, and I'm grateful for you spending the time with Cynthia and I today describing MyOutcomes. Hey, Cynthia.
Yeah.
I'm wondering if you had any final comments or thoughts, questions, or reactions.
Well, I've been involved with using MyOutcomes in my own practice for a number of years now, and I've just been very impressed at how it has evolved and become a very sophisticated and useful tool. So I'm really excited about the tool, and I think it'll be helpful to many clinicians in the future. And thanks to Cindy for going through all that with us today.
Yeah, and as always, you can reach all of us through the ICCE website. That's International Center for Clinical Excellence, and that's at ICCEXELLENCE.com, or you can just go to centerforclinicalexcellence.com.